There's a lot of expectation from ordinary South Africans, mainly those over 60, with the rollout of phase 2 of the vaccinations. Heidi Giokos has been following this story closely this week, and she joins me now. Heidi, this week, long queues at many vaccination centres.
Yes, indeed. We did see a number of vaccination centres with an influx of people coming in, specifically as there was a last-minute rush to get healthcare workers and support staff vaccinated as part of the Sisonke trial. Initially, Sisonke indicated that walk-ins were accepted, so if you did not have a voucher, they would accommodate you and vaccinate you. And this is why we saw those reports coming through, and eNCA actually witnessed this, where people that actually were not healthcare workers or support staff jumped the queue and got those vaccines. Mill Park also indicated to us that they indeed saw a couple of people slipping through the cracks, but of course it's the responsibility of every individual to be truthful, because if you take the vaccine when it's not your turn, you're taking it away from a healthcare worker or support staff. So we saw long queues, and this was of course because of the Sisonke trial ending. But yesterday when we went to a number of vaccination centres, we didn't see many people because most of them had wrapped up on Friday, and we know that just over 470,000 healthcare workers have been vaccinated under Sisonke.
Well, we've just heard the very unfortunate news that we're going to have load shedding. And you and I know that one of the vaccines that's part of our global rollout, or in our national rollout, is the Pfizer vaccine. That requires very, very cold temperatures. Do you have any idea how we're going to cope with that?
I am actually very concerned, because when we saw this notice coming out from Eskom to say there's going to be load shedding as of 5 p.m. this evening until 10 p.m. Tuesday, that is going to be extremely crucial with regards to how government plans on rolling out the vaccine for phase 2. We know phase 1B, which is specifically going to focus on healthcare workers that were not vaccinated under Sisonke, will be considered, will actually commence on Monday. But then we also do know that specifically for phase 2, it's going to be targeting the elderly. And this is going to be key, because we know it's Pfizer, we know there are no Johnson & Johnson vaccines for phase 2. So we do understand that it's going to be a bit tricky for government to make sure that these vaccines are in the old age homes, in the retirement homes, that they are planning to roll out as of tomorrow. We know that those who don't have vouchers or appointment dates cannot go to any vaccination centres. So how are they going to bring Pfizer into an environment where we don't know if they're equipped, we don't know if they have generators, we don't know if they have the capacity to keep those vaccines at the right temperature? So it's going to be interesting to hear what the Health Minister has to say this evening with regards to the actual plan, and that many people don't know what to do as of Monday. We know there's been a notice from a number of MECs in various provinces to say, don't go to the vaccination centres, we're starting in old age homes. But of course, this message actually hasn't trickled down. My father, for example, this morning asked me 100 times, when is my turn? And I said, you cannot go anywhere until you have your voucher or confirmation of appointment. So hopefully the message will get through to the masses so that people don't go to the vaccination centres and queue.
Now, we've heard that in Gauteng there are fewer vaccination centres. Is that a permanent situation, or is that just this week?
So we do know, according to the province's health department, they have said that it's only a temporary measure, because they are obviously not in a position to roll out or have more vaccination centres and facilities. And the reason for this is because they are targeting old age homes first. So there's no need to have a large number of vaccination centres for now, until they feel that they have completed all the old age homes and retirement homes before they move actually to the vaccination centre. So hopefully it's not a permanent measure that they've put in place, because we do know that many people cannot go, for example, to Chris Hani Baragwanath Hospital Vaccination Centre if they don't live in that area. There needs to be a number of vaccination centres. So according to the Gauteng Health Department, they've said that they will increase vaccination centres in the coming weeks.
So that's really important. I think we should just emphasize that. If you don't have your confirmation, certainly don't go this week. They're focused on old age homes. Wait for your confirmation, and that's either an SMS or a voucher.
Yes, 100%. I think it's extremely key, because I've actually been seeing a number of people tweeting and saying, we have no idea what to do tomorrow morning. If you do not have a voucher number or an SMS, appointment, time, date, vaccination centre, do not go to a vaccination site until you have those details. The department has indicated clearly they will only be targeting old age homes and retirement homes for now.
And if there are people still worried about not registering, That's still possible for them. It's not like that's shut down, right?
Yes, certainly. Many people actually don't know how to register. Many people don't have the facility or the capacity. They don't have cell phones, they don't have smartphones. They're not tech savvy. We're dealing with an age group that's 60 and above. Many people don't know how to operate the electronic vaccine data system. But we do know that there are people on the ground, community workers, trying to assist those that are unable to register to do so, and hopefully to do it soon, because we know that they're starting with phase 2 on Monday.
Thank you very much, eNCA reporter Heidi Giokos.